I came to Duke in 1983, February, and I was asked to come to organize and lead a newly constituted Department of Radiation Oncology. I was always interested in oncology, in cancer, as a terrific or difficult clinical problem that needed attention, and also a fascinating scientific problem. One of our principal research focus during the years that I was chair and led the department was in the field of hypothermia. There was a small hypothermia program here at Duke when I came, and it seemed like a good thing to build on because of the biologic potential, and it was something that wasn't being done hardly anyplace else in the country, so it was a chance for us to have a unique sphere of influence, if you will. So hypothermia is the use of heat as an adjunct to conventional radiation and/or chemotherapy. And what has been shown repeatedly in the laboratory is that hypothermia markedly potentiates both radiation and chemotherapy. And for certain cancers, and particularly for breast cancer, hypothermia is very effective in enhancing the efficacy of treatment. I think my biggest accomplishment at Duke was to establish the Radiation Oncology Department as a world-class program. And we were lucky and successful in recruiting terrific young faculty. You have to look for the best people and indicate that you're going to give them every support that they need in order to be successful. And the process tends to feed on itself. So once you get one or two really good ones, then the next ones are easier to get. And it was a good time. We had the resources to attract people, and we were fortunate to do so. I think the main thing I'd like to convey is the main positive thing about Duke, if you will, is the quality of the faculty and working with such excellent colleagues over the years in the other disciplines, as well as the people in radiation oncology. Of course, the faculty in radiation oncology has been outstanding, but the interactions with the other disciplines have also been outstanding. And that's what makes the institution the place that it is. My wife is Beatrice. We've been married over 50 years. We have 3 children, 6 grandchildren. They're in Washington, D.C., Philadelphia, and San Francisco, but all nice places to visit. I do a bunch of things. I'm not totally inactive professionally. I do some consulting work for the American College of Radiology. I maintain my office at Duke and do some teaching and some research, working with young residents. And I like to travel a lot. I like to try and stay physically active, work out a lot, ride my bike 3 times a week. And we travel a lot, both seeing the kids and grandkids as well as further abroad.